What drew me to medicine initially was the ability to help people in a way that not everyone has the opportunity to do. Orthopedics in particular, you're able to perform these procedures that really give people significant pain reduction and improve their mobility. And those two things together, it's quite miraculous the impact you can have on someone's life. And what's unique and special about my practice is that I employ the use of technology-assisted surgery, which is both robotics and computer assistance to perform hip and knee replacement surgeries, including partial knee replacement surgeries. So my philosophy of care comes from the fact that I, at one point, was an orthopedic patient. I've been on both sides of the table now, and I know how effective these treatments can be, but I also understand the trepidation that patients have when they're coming in for a procedure or just learning about what their diagnosis might be. So my goal as their surgeon is to provide the whole breadth and explanation as to what's going on, give them all the treatment options, and provide them with an evidence-based treatment plan to get them to where they want to be. Having a patient, that's older, may have grandchildren that are recent, and one of their long-term goals is to be able to kneel on the floor with their grandkids. And it's surprising how often that comes up when you see people in the office. And once they're able to do that, you just see their eyes light up, and they just feel so fulfilled that they're able to do that. So being able to help them in achieving that goal is something that I am very proud of.